let's blow your mind with another symptom that's connected to your pelvic floor. Eek! Welcome to part 2 of the series. If you haven't listened to part 1, go back and listen to it and then jump on board part 2. Let's do this. What up, my butthole breathers? How's it going today? I'm so excited to tell you a story and to let you know something else that I know no one thinks of, but is connected to your pelvic floor. But if you're watching on YouTube, I wanted to show you guys what will be my future office in our new house. So we moved and we've been sitting on fold-out chairs, beach chairs, and it's very uncomfortable and terrible for your body long term. Let me just throw that out there. But we're just like saving up, slowly buying, living in it for a little bit, seeing what we like, seeing what we need. But we did get a couch this week, and I will never take a couch for granted again. Like, it's amazing. And even the dog is like loving it, of course. But one of the rooms, I'm going to make my office and podcast spot because I do virtual appointments, virtual workshops, and I just want a space that feels good. And I am sitting in it today to show you. So here we go. Let's take a little tour. I'm by the window. Here we go. And you can see, obviously, some things thrown around. But have you ever done that? You just like, I think it's called, I guess, manifesting. But like, what? Sitting in here, what do I want this to be? What do I want it to look like? And I am not creative with colors and design and furniture. I can tell you what I like and what I don't like. But it's like me putting it all together. I'm like, And then I'm wondering, should I hang up some of my jerseys that players have given me? Or is that not really the vibe I want? I don't know. But I would love your opinion if you're into that, or just tell me if you think I should hang the jerseys or not. Hit me up at Dr. Audra Lance on Instagram. Oh yeah. Speaking of virtual workshops, now that I'm talking about it in this space, on January 9th, I am hosting my first virtual pelvic floor workshop, Restore Your Pelvic Floor. And we are going to dive deeper into essentially this 3-part series. But I'm going to bring you and give you actionable tips for you to actually help yourself. And it's not going to be kegels. F that. It is going to be things that over the years I have studied this and learned from people around the world and their techniques, combining all this in, and then taking the nervous system component, taking the stress component, taking the mindset component, and we integrate that all into one beautiful thing. And we have steps in order for you to heal your pelvic floor, because it is not normal to be yourself. It is not normal to have some of these other symptoms that are telling us that your pelvic floor is unstable, not correctly activating, too tight, and some of these other things that we're talking about, like in part 1 of the series, and then what I'm about to tell you, the story today, will be fixed by addressing this. It is so cool, and I'm so excited to help you. We're going to have fun, because the more fun you're having, the better results you get, which is why people fly in from all over the country and even other countries to work with me and my team, my office, because it's really hard to get in with me. So I have amazing doctors at the office who also do in-person and virtual appointments. But I really want you to restore your pelvic floor so that we can hang out. I do want to see your face. And that's why I limited the number of spaces we're going to allow. I want to see your face. I want to interact. I want to hear if you have a question. I want to hear about you. And I can't do that if there's 300 people on there. So spaces are limited and they're going fast. So the link will be in the show notes. It's only $139. Like, this course in an hour and the stuff we're going to get into is valued at over $1,500. But I'm like, it's the holiday season. I want to help people. We are not going to go through 2024 peeing ourselves or having these other difficult symptoms. We are going to take the steps, and I'm going to help you. Like, what I've learned, what actually works. I've been doing case studies in my office on this. I know what's going on, and I want to help you. Sign up. I can't wait to see your face, and we're going to have some fun. And forward this episode or this series to some friends and let them know about Restore Your Pelvic Floor. It like these conversations of, it's let's tell 2 stories. Let's start with this one. I'm a little bit of a chipmunk, as you know, and if you've been a loyal listener, which if you've been a loyal listener, thank you, thank you, thank you, thank you, thank you, thank you, thank you. Story 1. I try to do 30 seconds a day of something for me that's joyful. And I put my phone aside, and this changes. But the other day it was get a fancy latte, warm, and just sit outside in the sun and sip it. And I did it. I like schedule myself back to back. So I don't really have the time during the day, but it worked out where I was like, okay, I have 20 minutes and I'm going to do my 30 seconds like I preach. And it works. Like, this regulates your nervous system. It just lets you breathe. And I actually did some of the pelvic floor stuff we're going to talk about and restore your pelvic floor as I was sitting there, because it's so easy. You can do it anywhere. But as I was waiting in line, I am an eavesdropper. I don't know if you all are, but I just love knowing what's going on in other people's lives. I'm so fascinated by people. I mean, it's just so cool. And I've been like that since I was a kid. Like, when my mom was on the phone, I would go pick up the phone upstairs, because we didn't have cell phones when I was young, right? Like, I would go pick up the phone upstairs as quietly as I could and just listen to the conversation. Or when I was supposed to be in bed, especially when I had babysitters over, I would go sit on the stairs after I was supposed to be in bed and just listen. And really, I mean, I was straining, because you can't always hear, right? And I was like, just because I want to know what's going on. And so when I'm really standing next to you in line and you're talking, I can't help but overhear, right? And they're talking loud. And it was like 2 friends going out for coffee. It seemed so cute. But the one girl goes, I peed myself for the first time the other day. And I was so embarrassed. And her friend goes, oh, girl, welcome to getting old. That's normal. And I think my mouth was hanging open, because I was like, what? And the friend proceeded to tell her her favorite panty liners, which ones are the most comfortable, which don't feel like a diaper, going on and on and on. And then I just couldn't help myself. I really couldn't help myself. I've interjected, excuse me, I couldn't help but overhear you. And this is something that I'm so passionate about. And I do as a doctor in my practice all the time. It is not normal to pee yourself. Like, there is hope out there. Please let my office, the doctors, we can help you, or get on this call, workshop, Restore Your Pelvic Floor, or both. And we can tackle this. There's answers. Just because it's common and society is all like, no big deal, no big deal, doesn't mean it's normal. And I'm telling you right now, it's not normal. You also are not alone. It's so common. Third, you do not have to have had kids to have pelvic floor dysfunction. All these symptoms we're talking about, part 1, what I'm going to tell you this next story, can happen to anyone, whether you've had kids or not. So we need to talk about this more and not blow it off. And so I feel like I did a good service too, right? Like, I'm helping people out. And that's my number one goal of becoming a doctor. Like, I played doctor with my Barbies and my stuffed animals all the time as a kid. I have just wanted to help people. And so that's what I'm trying to do day in and day out, whether we're at the coffee shop or whether we're in our office or whether you flew me out to consult on your case. So here we are. Speaking of that, story 2 that I wanted to talk about today, of something that you didn't know was pelvic floor. I had a patient fly in to see me because they were scheduled for hip surgery and they wanted multiple opinions, which, if you are getting cut, and I don't care what it is, unless it's in a red, emergency, you need to get multiple opinions before you cut. It's a big deal. And as much as surgeons and stuff want to be like, oh, it's no big deal, I do this all the time, which is great. You want that. But you need multiple opinions, because in medicine, we all see something a little bit different. We all have a little bit of our own finesse. There's an art portion to medicine. Yes, there's a huge science portion, but each doctor has their own piece of art, vision, dance, whatever you want to call it, on top of that, which you need to see who you connect with. We've talked about this in previous episodes. So they fly in, they wanted my opinion, and we do an assessment and go through everything. And I'm just like, the whole time, something's not adding up. This is not adding up. And we go deeper, dig deeper. I'm looking at their foot because we got to look at the whole global pattern. We look at their neck and their shoulder. We look at how you breathe, look at your lifestyle, your stress levels, go into and dig. And I'm going to shoot you straight up, whether you want to hear it or not. That's my responsibility. I will do it in a kind way, but I want you to also hear me. Like, I looked at them and I said, it's not your hip. This hip surgery won't work. And they just were like, well, what? I said, it's your pelvic floor. Your pelvic floor is causing this hip pain and your pelvic floor dysfunction. And it's not that it's not strong. It's that it's just dysfunctional. Like, you've been sucking in, holding your breath, doing crunches and sit-ups and all these terrible ab exercises for years, and your body doesn't even know how to fully activate that pelvic floor. It's like a diaper. And it's kind of a saggy one right now because it's bleeding out and the poop's going out into your hip, causing this pain. We need to retrain this so that it's like cute little boy shorts and your hip pain will be gone. They're like, okay, because that's kind of, I mean, you're prepared for surgery and someone's telling you don't need it. I mean, that's a mind fuck, right? Like, yeah. And then, I mean, there's always the case, I could be wrong. I mean, I have years and years and have seen thousands of patients of clinical experience, but I also like to humble myself of like, hey, this is what my findings indicate. Let's just like push the surgery off a little bit and try a more non-invasive thing first. And if this doesn't work, we'll go to it. And so they agreed. They're like, let's do it. So we do treatment, obviously, in the same day. We're not like, we don't see you and say, we'll treat you in 2 weeks. If you're coming in, we're going to hang out for a little while and get to the bottom of it, including treatment. So within the first thing I did with them, they were like, Audra, it's not gone, but it's better already. Like, I'm having relief. And we dig in a little more. And by the end of the first visit, it was 60% better. Not 100%. Like, listen, this has been going on for a long time. It's going to take a second. Like, it's not just always snap your fingers magic. I wish. Sometimes it is, but that's pretty rare. And I was like, okay, here's what we need to do for a treatment plan. They're like, okay, well, we don't live here. So they're going to do the Elite Edge program that I created where I am the overseeing doctor. You get your first consultation with me, and then one of my other doctors I pair you with based on your case executes the game plan I put together for it, virtually or in person, and we meet and discuss the case after every appointment. So you have 2 incredible doctors on your case. That is unheard of in this industry. It is game changing. And so they signed up for the Edge Club, and we're doing it. So the surgery's canceled. They're good. I mean, how cool is that? Like, I just get so excited. I mean, like, that's life changing. And could you imagine if they would have had the surgery and it wouldn't have worked? My heart breaks. And it's not the surgeon was bad. No, because they did have findings in their hip. I mean, all of us, if we get an MRI or something, it's going to show up, oh, you got a disc, or you might have a little labrum tear. It doesn't mean that's the source of your pain. Like, we need to figure out the source and the root cause of your pain. And it doesn't mean you won't have findings or you feel it, but that doesn't mean that's the source of your cause. Your hip, low back pain can be coming from your pelvic floor, and it needs to be ruled out before, especially before you do a more invasive procedure, such as injections, surgery, so forth. And I hope that if you're thinking of someone right now, if this is not, you forward them this episode so they can listen and hear. And it's wild and crazy, but it's also so simple and scientific. And let's help each other out. Let's join Restore Your Pelvic Floor, where we'll get more and more into this and dive deeper and give you solutions where you can start helping yourself to get relief. I am honored to be able to share all this information and stories with you. And I got permission from that person to share the story. So don't worry. It's not like when you see us, you're immediately going to be blown up on here, talked about your case. We're going to ask permission if it's that. So tap the 5 stars, write a review. Let me know if you even thought of this as being a source of your cause of pain in your pelvic floor. it's just really crazy. So link is in the show notes for Restore Your Pelvic Floor. Share with your friends. Tag me. Share this episode on Instagram and tag me. I love to see it. I love the conversations we're having via email. If you want to be in my MTR weekly list, I send certain cases, certain exercises, celebrity level health secrets that I'm with every day. And you guys get some of the behind the scenes stuff for free every week from me. And it's just, you never know what I'm going to share. And that's going to be different than what I share on here. But yeah, I hope you have a wonderful day, and we'll get to the bottom of this. Crack myself up. Your pelvic floor, your bottom. Your butthole is actually part of your pelvic floor. That's why my signature line is breathe into your butt. So I want you to have a freaking awesome day. Toodaloo.